Hello, everybody, and welcome to the Community Checkup. My name is Mark O'Hearn. I'm glad that you're joining us today. Every month on this podcast, we're going to take time to talk about healthcare issues that matter right here in the Eastern Panhandle. My goal is to really have honest, practical conversations with people who are doing the work. These are our clinicians, our health leaders, community partners, so that we can better understand what's happening in the health of our Panhandle community. This first episode is going to focus on how WVU Medicine is investing in the health of the Panhandle with more than $200 million in projects that will be bringing advanced care here to Berkeley, Jefferson, and Morgan counties. Today, I'm joined by Dr. Ben Deuell, Emergency Department Regional Medical Director and lifelong resident of the Panhandle community. Let's get started. Ben, when we talk about our investments and growth, we say the future is here. What does that mean to you?
Yeah, so I think the future is here. Is as a Panhandle lifelong community citizen is exciting because we've waited for this for so long, and the future is here. Even though you see lots going on around our campus and our community to try to expand and grow services, we're doing a lot of these services already. So we finally have made it. The community realizes it. The community sees it with new leadership, new administration, new clinical services we're offering, and we're doing it right now.
And that's fantastic. I mean, in terms of the day-to-day in our emergency department, what are the major projects that are most exciting that you're seeing come to fruition?
Yeah, so I think overall the major projects we really want to really excel or talk about is um, capacity. So we are going to be moving forward with increasing our capacity on our inpatient side to make sure that when our patients come to the emergency department, they have a space dedicated to them. It's space dedicated where they can be seen in a traditional manner. We're going to expand our pediatric services and really focus on our young kids and giving them a dedicated space to be able to be evaluated, treated, and stay within our local community. We're adding more observation services in order to get people into just that hyper acute admission phase where we're able to keep them local, keep them their care going quickly, and then transition them home as fast as possible and as safe as possible.
That's great. And I mean, if you come on the campus now, you see lots of construction happening, building a new bed tower. What does that mean to this community, and what's the timeline associated with it?
Yeah, so I think construction can be intimidating, I think, to a lot of people. To me, construction is exciting because that's the proof that we're moving forward. So too often, people talk about things we're going to be doing in the future. Well, now it's proof. We've broken ground. We're putting up infrastructure. We're moving signs around. We're helping guide people safely to where they need to enter the campus. So one and most important thing is that we are still operating normally. Yes, you enter through a different part of the hospital, but our emergency department is still operating fully and functionally. Our hospital services are already expanding. So I don't want anyone to think that we're not offering normal day-to-day services within our campus. It just looks a little bit different as we get ready to move forward with these huge, amazing projects.
Yeah, and so obviously the new bed tower will move us from 200 beds to 325 beds. That's a huge increase in capacity. These are going to be all private rooms as well. The new patient tower is expected to open in early 2028. We also have some construction going on for our WVU Cancer Institute. Can you tell us a little bit about that?
Yeah, so I think that if you look at some of the construction on our campus there on the southern part, you notice we put up a new structure attached to our Dorothy McCormick Center, and that is our LINAC Vault, where we're able to offer more frequent and more advanced services for our cancer patients, a much needed service. And it is one more thing we're doing to keep people home that need care. And I think that's the most important thing. We know that traveling is one of the hardest things that we have to do in healthcare, or having the conversation with someone that we just aren't able to offer this service here. So we need to help transfer you or move you to another location. Well, now we want to move people to us, and from all aspects and all care. We want people to come to us. And this is just proof that we're expanding those services, expanding those providers that are able to help treat patients with, unfortunately, some diagnoses sometimes that are difficult, but if you can stay home, that makes it so much easier for the patient and their families.
Yeah, absolutely. And I know that Radiation Oncology Center should be done in October this year, so not too far. As we move down to Jefferson's medical campus, they're going to start to see some fencing going up around the perimeter of the campus. Maybe tell us a little bit about that expansion and kind of how you see Berkeley and Jefferson campuses coordinating care better.
Perfect. Yeah, I think Jefferson is an amazing hospital, and it is one of our critical access hospitals, but it functions as an acute care hospital in so many ways, offering patients in Jefferson County a great resource that does a lot of acute care, a lot of great care. And what we're doing is adding services on the ambulatory side so patients could come, have a one place where they're going to focus their care, be in the hospital vicinity, be attached to any other services that they may need, and really expand that ambulatory footprint while still offering new inpatient services, excellent emergency care. We're going to start increasing the surgical services we're able to offer there to really help improve that community's short distance and having to come to Berkeley for things that Jefferson can certainly take care of and handle. And then use both our campuses to its full capacity to make sure that we are keeping people where they need to be appropriately, but also helping them kind of come to the area where it's easiest for them.
No, that's great. And, sometimes the perspective is if you go to Jefferson, you're probably going to have to get transferred out of that campus. I know the latest statistic I saw is about 96% of people that come to Jefferson stay, get treated at Jefferson, and can go home. So a very small fraction actually have to be transferred to a higher level of care, which is fantastic. In addition to the new ambulatory building on that campus, I know that we're breaking ground on a new medical oncology and infusion center up on the third floor. Groundbreaking happens later this month, and those projects should be completed. The oncology will be completed in early 27, and then the larger ambulatory in 28. So, very excited to bring all this new construction and growth to the community. Kind of on that note, as we see such growth, our workforce is growing. And so, to be able to take care of patients, lots of concern in the community. Will you have enough physicians, mid-level providers, nurses, and frontline staff? Talk a little bit about what you're seeing in terms of people joining the East team, and how is that impacting the services that we're able to provide?
Well, wonderful. I think that we feel for the first time in a long time, and really the first time I can remember in the 10 years I've been with the healthcare system, people are pushing to come here. And that has not been something we have felt in the past. It is every day we have people applying for physician jobs, APP jobs, staff jobs, ancillary services. They want to come to WVU Medicine because what we are offering from an employment aspect is awesome. And at the same time, they see what we're doing with healthcare. They see how we're expanding. When maybe there's other areas that people aren't expanding in healthcare in the region. So we want to prove to people in the community that we are going to be expanding all these services by also expanding our employment. I know that our director of HR has mentioned we're at the highest employment rate we have been ever, and our retention rate continues to be astronomically amazing. So we have hired well over 100 physicians already this year. We're going to continue to expand that with APP services. And I think what I tell people that we're recruiting, why we're recruiting so well, is because we are passionate about how we're growing, and we are really passionate about the healthcare we're already offering and then where it's going to be going in the future.
Yeah, that's fantastic. And I know too, it was recently announced that we're partnering with Berkeley County Schools to develop our own nursing program, trying to build out a new surge tech school, possibly a CRNA school in the future. Is that going to be a big part of our workforce development? Is actually building these schools, partnering with the local high schools so that we can keep our residents here with great jobs so they don't have to leave the area?
Yeah, train local, retain local. I think that is the motto that we know is going to work. Individuals that are invested in their community by growing up here and then going on and doing some sort of secondary education within their community really are going to be invested to stay. I think there are great programs that already exist in our community for surge techs and for nursing. And then we are just going to expand on that because we know that the need is there, and we know that it will be a successful program. And Berkeley County Schools and WVU Medicine have always had a relationship, and I think it has just got so much better just in the short term. And I think there's also more opportunity just all over the region to find people that we could pull into this area to keep. It's going to be a great addition.
Yeah. And I mean, obviously, we're an academic medical center. We have a medical school. We have third and fourth year medical students on the campus every single day. We have a long-standing tradition with our family medicine residency program. We now launched our internal medicine residency program. So we have a lot of physician learners on the campus as well. We recruit a lot of them to stay in the community. And part of the recruitment is that these providers feel like they can provide a comprehensive array of services and don't have to refer a lot of those patients out. So, you talked a little bit earlier about keeping care local. What are some of the new services and capabilities that we added recently that are allowing patients and families to stay here in the Panhandle rather than having to travel down to DC or into Morgantown for that care?
Yeah, so I think a lot of it is around surgical subspecialty. Orthopedics is a huge one. We're expanding our WVU orthopedics group and hiring trauma orthopedic surgeons and expanding that as well. Our gastroenterologists are fully up and running and just astronomically increasing their bandwidth on how many patients they're able to see and provide services. Um, our Heart and Vascular Institute continues to expand, and we are looking for open heart to begin just in a few short months. Is one of our major things that we are transferring out when patients have high risk heart disease and need intervention. We will start to keep them local and really build out that program. We're expanding our ability to do specialized dialysis and CRRT within the hospital. Our pediatrics department is looking at how can we expand and keep some of our pediatric cancer patients local that really just need a touch point with our Morgantown pediatrics oncology team, but they can stay close, which families really desire. And Dr. Rocheford and the pediatrics team are trying to identify ways for that, which I think is going to be fantastic. So there is always opportunity to look for services to expand on, but I think we are really focusing on the ones that we are having to leak out to Morgantown or to other healthcare systems to try to keep them local. And that's what patients want, parents want, and that's where we're going to really focus.
Yeah, it's great. It's great to see so many new specialties joining our community and keeping that care local. With all the new homes, I mean, there's a tremendous amount of new residents in the community, people maybe that haven't used WVU Medicine services previously. Access to primary care is really, really important to establish that care and be part of our network. It's been a big focus over the last 12 to 18 months. From your perspective, are you seeing improved access to primary care in the community as an ED provider? And how is that impacting the ED as well in terms of how you're coordinating care?
Yeah, so I think that there is a shift in emergency care over the last several years, really post COVID, where emergency departments are offering primary care as a way to help keep communities whole. With WU Medicine in our Eastern region, we noticed that there was a long delay in how fast people could get established with the new primary care. And that number has dropped significantly over the last really 6 months to year, where patients that need a primary doctor are getting one within just a few weeks. And that can be a primary physician, that can be a primary APP. And what we are noticing is less and less people come in that need primary care. And when they do, we now have a list of and a network of providers that are able to get them in a routinely quick fashion, really provide excellent care, and then really help patients avoid what is a high stress situation and coming to the emergency department for not necessarily emergent care. We are absolutely happy to see them and take care of them. It's a service we enjoy to offer, but we can really start to push those to urgent care. A lot of our urgent cares are within our primary care buildings, so we're able to offer kind of a dynamic pathway there where they can get seen, and if they need a little bit something else done, they can get that established as well. But patients in the community are excited because they are seeing that there are people to see, and how you find them is easier. Get online, look at the website. You can easily go on and schedule appointments with our primary care providers. I just referred someone last night and showed them on the website personally in the ED and said, this is where you go want to do online scheduling. They're not used to that, and they're excited to start seeing that.
Uh-huh. Yeah, so self-scheduling is a huge initiative, something that we had historically not had turned on for a lot of our providers. So the ability to make it really seamless, you can go right on my chart, you can go on Find a Doc, you can schedule for a new provider visit. I know we have 7 or 8 new primary care providers starting over the next couple months, in addition to the improved access. So it's really great to see certainly that coming together. As you look forward over the next sort of 3 to 5 years, what do you see as the most important innovations or changes that we're going to be making and that the community is going to be seeing in the Panhandle? And how do you think our community and our teams can kind of help us get there?
So the vision is we are the regional hub for really WVU medicine. And if you look at what we're going to start offering and already are starting to offer is bringing patients here from all over our region. So we have a multitude of hospitals within WVU East, in Kaiser with Potomac, in Petersburg with Grant. Fulton is going to be coming on live with us in early or in this year and in early 2027. And what we're doing is going out to these communities, offering them our services, but then reminding them that they need to bring their patients to us for the continued care when they need acute care or services they may not offer. Our neurosurgeons are going to our VA medical center now and offering outpatient appointments, setting them up for surgery locally in our community and following them. Our gastroenterologists are going out to our critical access hospitals in the East and really offering service a few days a month. We're going to be sending orthopedic surgeons to our local regional hospitals to offer care, really to get people to stay within the healthcare system, to get them to stay home, and then realize when they need something a little higher level, they're going to come over this way to Berkeley Medical Center. Great point that we're seeing a lot lately is we used to fly patients out all the time. I'd hear helicopters coming out over our house, heading west to Morgantown. And now we see patients coming in from all over the region, within the state and outside the state, where care we're able to provide that no one else is able to provide in the region. And they're bringing patients to us. And I think the more we can increase our transfers in, the more that our patients are going to be excited to see that we are offering some of that high specialized care. And a great point is our neurointervention. There are very few areas in the region that offer any neurointerventional services. And now we are pulling people from a huge bandwidth area and starting to get patients to come here to get high level neurological care, which is something we've just added within the last several years.
Yeah, absolutely. For stroke care, time is brain, and for heart care, time is heart muscle. And having those interventional capabilities right here at Berkeley are critically important in saving lives. It's really awesome. In your role as a regional medical director, some may think that you just oversee Berkeley, but you have a lot of oversight for all 6 of our regional hospitals in the East. And I know when I joined a year and a half ago, we were just standing up our transfer center, which you run as well. Can you tell the community what the transfer center is all about? How does it work, and what does that really mean for Berkeley?
Yeah, so we have a great team that runs what's called our Bed Command Center. So it is the central hub for communication in regards to transfers and transports within the region. We service the WVU East aspect for things that need to come in or move out of most of our hospitals. We have a dedicated administrative team from nursing to a medical director that helps assist with that. And really what we're doing is identifying the capability and capacity of each of our hospitals within the region through this Bed Command Center to make sure that patients are staying where they need to be or coming to where they need to go where that service is offered. Sometimes even coming to our hospital in Berkeley and then moving back to the hospital that their primary home is near, so they can still have that high level acute care but stay close to their homes. We run greater than 700 phone calls through this centralized hub a day. We try to make it an ease of access for our providers. A one call does it all. So from the point you need to make a decision that a patient needs something higher level or needs a service that may not be offered at one of our smaller hospitals or even at Berkeley Medical Center, you can make one phone call, get in touch with the specialist or hospital that you need to get in touch with, work on focusing how to get that person transferred in the most expeditious way and the most appropriate way. Or getting a little bit of reassurance that maybe they can stay local and we're going to help you at that hospital or help this patient continue to stay local and get the care they need.
Yeah, I mean, really, the right care in the right place at the right time is the focus of that program. It's going very well. Less transfers to Morgantown, more care local. I just want to thank you, Dr. Deuell, for your time today. You have been a leader in this community for many, many years. We're so lucky to have you on our medical staff and in our leadership team. And if anybody listening would like to learn more about today's topic or find local services and support, you can visit wvumedicine.org/future is here. Thank you so much for listening to the Community Checkup. I'll be back next month with another conversation focused on health in the Panhandle.